If you've had pain for months or even years, you have probably done everything you were told was right to do. Rest, ice, stretching, physical therapy, massage, and yet the pain is still there. So by the end of this video, you will understand why these tools sometimes fail for chronic pain and what mechanism is actually keeping that pain going. Hey there, Jessica here. I'm a therapist in Austin, Texas, who specializes in chronic pain. And I help people understand chronic pain through a nervous system and brain based lens. So make sure to stick around until the end because I will explain the single reframe that helps people stop seeing their body as damaged and start seeing a different path forward. So my first point that I want to make is not all pain works the same way. So I want to be clear that rest, ice, and stretching are not bad tools. They're great tools for certain types of pain. Acute injuries, tissue healing, situations where the pain is coming from some sort of ongoing physical damage. So if you sprained an ankle, strained a muscle, had a recent surgery, these approaches often make sense, but not all pain works the same. So at a high level, a very maybe kind of oversimplified level, pain tends to fall into two categories. And we tend to treat all pain as if it falls into the same category. So the first category is what I will call structural pain. So this is pain that is driven primarily by tissue damage or inflammation. So there's an injury, tissue is irritated, it's healing, and the pain is proportional to what's actually happening in the body. So this is a situation where rest reduces strain, ice will reduce the inflammation, and stretching will improve mobility. And so these tools actually target the source. However, chronic pain can be a completely different ball of wax from acute pain. So the second category, and most chronic pain actually falls more into the second category. It's pain that's being driven primarily by your brain and your nervous system. So here, maybe there never was an injury, or maybe there was an injury, but it's healed. The tissue's healed, the scans look normal, your strength and your mobility may be adequate, but your brain is still essentially producing these pain signals. All pain gets generated in the brain, all pain. Whether you broke your leg or you think you broke your leg, that pain gets generated in your brain. It all feels the same. It all hurts the same. Nervous system based pain does not hurt any less than structural pain. So I just want to make that clear right there. But this second type of pain, this pain that's really driven more by your brain and your nervous system, I tend to call this neuroplastic pain. There's a ton of different words for it: neuroplastic pain, nociplastic pain, centralized pain, primary pain, mind-body pain, TMS. I'm sure there's others I'm forgetting. There's like 10 different terms for the same thing. But this is really a very different type of pain. And I think it requires a very different type of approach. And this is often where people get stuck, is they have chronic pain and they're treating it in the same way that you would treat acute pain. And it's really not the same type of pain. So let's talk about why these body-based tools will stop working. When your pain is being either generated or amplified by your brain, by your brain and the rest of your nervous system, your brain is part of your nervous system. The problem actually isn't things like, it's not structural, it's not tight muscles, it's not weak joints. The problem is that your brain has learned to associate certain sensations or movements or contexts with danger. So rest, ice, and stretching work on the body. But neuroplastic pain, which is, again, what most forms of chronic pain falls into that category, that pain is maintained more by things like prediction, things like threat detection in the brain. So what can happen is you rest, you ice, you stretch, and maybe the pain does go down a little bit. It's not to say that it can't get you some relief, but that relief never lasts because the brain never updates its prediction model. Instead, your nervous system is learning, oh, this area is fragile, or movement is risky, or pain means damage. It's natural to think that if you're in pain, there must be some kind of physical damage in your body. However, that isn't always the case. There's actually some research. I'll try to link it below. Done into looking at MRIs of backs. And if you look at MRIs of backs, most MRIs are going to show some kind of something that looks abnormal. The only people who really have normal, like beautiful, perfect spines are babies. Most of us have something in our back that's going to look abnormal. But apparently there's no correlation between pain. There's people with back MRIs that look totally messed up and they're not in much pain. And there's people with back MRIs that look okay, for lack of a better way to explain it, and they're in tons of pain. And so we know that there's not a lot of correlation between how much pain someone's in and what actually shows up on a scan. So the relief doesn't last. Whatever relief you get from rest, ice, et cetera, the relief doesn't last. Again, not because these tools are bad or wrong, they're just not targeting the right thing. So if this is clicking for you, please consider subscribing to the channel for more brain-based pain education like this. All right, so I'm going to move into my next point, which is why doing more often backfires. And I've done quite a few videos kind of on this theme, because this is the theme I see really across my specializations, certainly with chronic pain, but I also see it with insomnia. I also see it with maladaptive overcontrol, which is another specialization I have, which you might be thinking, what the hell is that? So I've done actually a whole video about that. I'll link that up here. But people who just work really hard, who try really hard to make things better, and doing more often backfires in a lot of situations. So when it's not working, a common response is to just like double down, do it harder, do more stretching, more treatment, more doctors, more scanning, more monitoring. And from the brain's perspective, that increased focus can signal this is dangerous, you need to stay alert. And then your nervous system stays activated. And anything that puts your brain on high alert is also going to make you more susceptible to feel pain. So pain persists, not because you're broken, not because you're screwed up, but because that alarm system just never gets to power down. So it's why chronic pain feels so demoralizing, because you're doing everything you were told to do, and it still isn't working. So here's a key reframe. When the pain is being maintained by the nervous system, the goal isn't to fix damaged tissue. There might not be any damaged tissue. It's to help the brain update its prediction of danger. So this is where approaches like pain reprocessing therapy come in, which is what I do. And pain reprocessing therapy is not just positive thinking. It's not unrealistic positive thinking. It's not ignoring the pain. It's also not pushing through, but it's really trying to address that pain where it's being generated, which is in your brain. Again, I want to emphasize that does not mean that pain is pain. Any type of pain. I mean, all pain is generated in your brain, even if it's clearly structural, like a broken leg. You break your leg, messages get sent to your brain. Hey, brain, there's something going on down here. And then the brain makes a judgment call as to whether to generate a pain response to get the human to do something about it. So regardless, it's all being generated in your brain. But this doesn't mean that pain is any less real. Pain that doesn't show up on a scan is any less real than pain that would show up on a scan. The real question really is what's driving it now, and where do we intervene? Sometimes body-based interventions I think are great for acute pain, but for chronic pain, I think we need to bring in the brain. So if rest, ice, stretching, all that kind of stuff hasn't resolved your pain, it doesn't mean you didn't try hard enough. It doesn't mean you didn't do the right exercise or didn't do the exercise right. It doesn't mean that nothing will help. A lot of the time, it just means that your pain is no longer, or either no longer or never was, related to a tissue problem or related to a structural problem. It's a learned nervous system pattern. And the cool thing, believe it or not, is this neuroplastic type of pain is actually easier to address than structural pain, because it's a learned pattern, and learned patterns by definition can be changed. So if you're liking this so far, in addition to subscribing to the channel, I've also sent out a monthly newsletter where I write content related to chronic pain, as well as related to my other specialties, which are sleep, PTSD, OCD, and then that maladaptive overcontrol that I mentioned earlier. So I kind of rotate through the topics month by month. So I mentioned pain reprocessing therapy earlier. If you're curious, I did record myself talking through what a first session of PRT might look like. And so I'll link that. I think I'll do that on the end of the screen. If you want to check that out, and maybe I will see you over there. And then to wrap up, I just want to say that this content is for educational purposes only. It's not a substitute for professional mental health treatment. I'm also going to try to link a directory. If you're located in the state of Texas and pain reprocessing therapy is interesting to you, you can feel free to reach out to me. But I'm also, there should be a directory. They've made some changes to the PRT directory, so I'll need to figure out where that link is. But I'm going to try to link a directory down at the bottom. And with all of that, thanks so much for watching. I hope this was helpful, and I hope you have a good rest of the day. Thanks.